Okay. Hello, everybody. I see people are still arriving. Welcome to those of you who are just arriving to our next bi-monthly installment of our successful public health approaches in dementia caregiving roundtable series, where we feature one state at a time and really highlight their dementia work, public health work, narrowing down into approaches and strategies in caregiving. Today, we will be hearing from our colleagues in Puerto Rico, and we are very excited to welcome Elba. You will be hearing from Elba in just a few minutes. Next slide, please, Ashley. Before I begin, I would just like to introduce myself. My name is Elma. I am the coordinator, one of the coordinators of the Bold Public Health Center of Excellence on Dementia Caregiving. My colleague Ashley, who you often do not see, but who is instrumental in all of the work we do. We really wouldn't be able to offer our programming and our events without Ashley's great help. She's also here with me today, also available to answer any questions. Next slide, please, Ashley. Whether we work in the physical or the virtual space at the University of Minnesota, which is where our center is located, we like to begin by centering us, by grounding us all in a land acknowledgement, reminding us that the University of Minnesota in the Twin Cities is located on ancestral, traditional, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people, and we take to heart and commit through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. And before we continue, it's really important to, when we read these land acknowledgements, really think about how we translate them into action. What can we do to support our local Indigenous communities in our community where we live? In Minneapolis, I, for example, live in the heart of our urban Native American community here in Minneapolis, and I invite you all to visit the website of the Minneapolis American Indian Center, just down the street, and to think in your own community, what organizations might you be able to approach, support in whatever way makes sense to you and to your community, whether it's through donations, volunteering, or promoting or attending their events, really to promote that heritage and values of Indigenous communities. So, thank you. Next slide, please. I know many of you are already familiar with our center, but just in case a few are new, our BOLD Center is really designed to work with public health agencies and build public health capacity and expertise in dementia caregiving. So we do that by improving access to programs and approaches that have been shown to work to support and improve outcomes for family caregivers, for people with living with dementia. We do that by fostering connections and collaborations between public health agencies and a variety of other partners they collaborate with in the space of dementia. And finally, providing one-on-one expert assistance, whatever that might mean for each individual agencies, thanks to our national network of members. They include really organizations, experts and leaders in development of tools and programs to support caregivers. This specific roundtable series falls in that second category of facilitating connections and collaborations among partners and learning from one another. Next slide. And before we begin, please, just a reminder, as you leave, you will be prompted or invited to tell us about your experience today. If you have any feedback or any ideas for future programming for our center, you can scan this code or visit this bit.ly link. Thank you. A few reminders for today. As I mentioned, this is intended to be a peer learning space for sharing and learning from each other's experiences. This is a Zoom meeting format, so please mute yourself and turn your video on while the panelists are presenting so they can see. We can create that familiar feeling of meeting in a small space. Please put your name and your organization, all of your questions as they come up, and as you listen to the speakers, please put them in the Q&A feature rather than in the chat. Whenever possible, please. It's easier for us to ensure that we answer them all throughout this session. Today's session will be recorded, and we will share that with you and all the people who registered. And yeah, use the chat to share your resources, your links, your websites, anything that is relevant to today's topic that you would like to share with the others. Thank you very much. And next slide. Before we begin, let's just take a poll. Let's take a pause. Who is here in the room today? My colleague Ashley will run a brief poll. You should see it on your screens. Please tell us in what capacity you're here today. Are you a public health agency? Maybe you work for one. Are you a person living with cognitive impairment or dementia? Are you a community organization? Yeah. Yeah, the numbers are similar to what we see in most of our events, and Ashley will make them visible to all. Thank you, Ashley. About a third are community organizations, service providers, those partners, right, with whom public health agencies partner and collaborate. Then we have just over a third of public health agencies, and as well as caregivers, people living with dementia, and clinicians. Thank you all for being here. Next slide. Here, without further ado, I am going to hand it off to my colleague Elba Liz González Márquez. Bienvenida a esta serie. Es un placer por fin tenerlas. I have been very excited to, ever since I met the Puerto Rico team, to share their work with all of our BOLD community. I've been so impressed with the thorough and thoughtful approach they've taken to mapping the community partners and really engaging a broad-based community of the community members in their work. So Elba, the mic is yours. Thank you very much.
Thank you so much, Elba. Thank you so much for the warm introduction. Good afternoon, everyone. What a joy and a pleasure it is to be here with you today. Send you a warm tropical hug from Puerto Rico. My name is Elbalis González Márquez. I am the BOLD Program Coordinator at the Center for the Coordination Services for Persons Affected by Alzheimer's Disease of Puerto Rico Department of Health. From this point on, I will simply refer to it as at the center because the name is very large. Joining me today are two of my colleagues who will be monitoring the chat and supporting us through the section. I would like to introduce them, Adia Ponte, our BOLD evaluator, and Rosana Quiles, our center evaluator. We are glad to be here together today. Thank you so much. Next slide, please. So let me start by sharing the three objectives that will guide our time together today. First, we want to present the Center core programs as a model for a structured public health response to dementia. Second, we hope to share lessons learned and data-driven strategies that strengthen caregivers' infrastructure at both the community and system levels. And third, and perhaps the most exciting part, we hope this section becomes a real space to exchange ideas and the best practice with all of you, so that together we can shape the future of dementia caregiving support. Before presenting the center programs, it is essential for us to understand the context that makes this work so urgent. Let's begin by looking at the context of dementia as a public health matter in Puerto Rico because the numbers tell a very clear story. As December 2024, the Alzheimer's case registry has recorded 54,473 cases, and those 68.6% have been diagnosed, especially with Alzheimer's disease. The prevalence of Alzheimer's and related dementia in Puerto Rico is 16.9% compared to 13.2% in the United States. That is a significant gap and it matters. And perhaps most striking, Alzheimer's has been the fourth leading cause of death in Puerto Rico since 2008. and since 2018, it's become the third leading cause of death among women aged 16 and older. With this prevalence rate significantly higher than USA, the evidence is clear. Addressing ADRD must remain at the forefront of our public health agenda. Beyond these prevalence numbers, we must also consider the rapid demographic shift and the significant economic way this career for our society. The demographic snapshot makes this phenomenon an even more urgent. Today, 28.5% of Puerto Rico population is 60 years or older, and that number is projected to reach 39.8% by 2050. The estimated annual cost per person living with dementia, when you combine direct medical costs and productivity loss, is $64,914. And approximately 53,929 people in Puerto Rico were identified as caregivers of people with Alzheimer's between 2021 and 2022. That represents 60.9% of all caregivers on the island. So, what does this mean in practical terms? It brings us to a simple but powerful reality about Puerto Rico in public health context. Puerto Rico is facing a rapidly aging population and declining birth rate and sustained outmigration. Together, these three forces are creating a growing care gap, and the gap would only widen if we don't act systemically. Behind this number, is a human reality which must be addressed. The specific profile and the immense burden carried by our caregivers in Puerto Rico. To understand the caregiving landscape, let's look at who caregivers are in Puerto Rico. Unpaid, family-based care is the dominant model. There are very few formal and paid caregiving arrangements. Women carry a disproportionate share of the caregiving responsibilities. The toll is heavy, not only emotionally, but physically and financially. And most of caregivers are largely untrained and unsupported. They are doing an incredible, difficult job, often without the tools or knowledge to do it well. In short, our current caregiving model relies almost entirely on the unpaid and unsupported labor of family, primarily women who are facing the crisis with very few resources. And these personal challenges don't exist in isolation. They are a part of much larger system-wide problems. There are limited respite and mental health services available to caregivers who desperately need a break. There are significant geographical inequities in service access. Puerto Rico is an archipelago, and the families in the rural areas or on the island municipalities of Vieques and Culebra face a very real barriers. Referral pathways are fragmented, and this fragmentation directly affects the quality of continuity or coordinated care. There is an elevated risk of caregivers burnout, especially for those managing multiple roles at once. And there are still important gaps in culturally responsive support service that need to reflect the values, the language, and the lived experience of Puerto Rican families. Now that we have a clear picture of the contents of the challenge, let me walk you through the legal framework that guides and supports the center work. Law number 13 of January 8, 1998 established the Center for the Coordination of Service for People Affected by Alzheimer's Disease. Its mandate is to coordinate service among providers and the educated health professionals and the general public. Law number 237 of August 15, 1999 established the Registry of Case of Alzheimer's disease, Huntington disease, and others dementia. More recently, Regulation number 9564 of July 5, 2024 updated the center regulations to better reflect the current reality and the service needs. Something important to know here. Despite this law existing since 1998, the center did not have a full-time dedicated team until May 1st, 2023. So it's very long time waiting for a team. That is when the real work began to build the infrastructure you will see today. With that content in mind, let me now show you how the center is structured and how its components work together. First, the evaluation component is a core. It keeps our work aligned, data informed, and continually improving. The service component delivers monthly virtual support groups, virtual and in-person educational sections, and direct community intervention. It's one of the most important components in the center. The registry collects and reports data on Alzheimer, Huntington, and other dementia across Puerto Rico, and that through the BOLD funding, we established the first dementia quality in Puerto Rico and launched from 2026 to 2030. And finally, our advisory committee provides guidance support across all center initiatives. Before we dive into the center specific programs, we want to hear from you sometime. This is a question for you, for all audience. What challenge have you observed or experienced in supporting dementia caregivers in your community or organization? Please use the chat or Q&A to respond these questions.
Thank you, Elva. Just
Okay.
as a reminder, maybe using the chat would be best because I think everybody can see the responses.
I'm gonna help you out, Elba, if I may.
Yes.
I see that Cynthia tells us language gaps, lack of awareness of programs, lack of home respite services. Cassandra has also lack of respite options, not enough respite opportunities, so we have a common gap over there. Lack of appropriate and affordable services, lack of resources and services, especially in our most rural communities. Coordination of services, lack of time and respite options, funding, transportation awareness, timely respite care, direct care worker shortage. So I think we share many gaps and barriers. Direct care, no help, and I, as a caregiver, get exhausted, so no respite services. Lack of services for uninsured, of bilingual and culturally appropriate services, lack of supportive day program, lack of coverage, lack of affordable paid caregivers to support family caregivers, emotional stress of end-of-life care.
Thank you so much, everyone. Thank you, Rosanna, for read all comments.
Of course.
Thank you, everyone, for sharing. As we can see, many of these challenges resonate across different contexts, and that is exactly what connects us today. As we receive your response, I want to connect them to the theoretical framework that guides our work, a care coordination model from social work perspective. Let's look at the 4 pillars of the model on the next slide. This slide is very change something the visualization, but it's well. This slide captures the 4 pillars of our social work care coordination model, the framework behind how we serve caregivers in the center in Puerto Rico. The systemic framework, which see the caregivers and patient as a part of a larger interconnected system, not in isolation. The reality of family dynamic is very important because recognize the emotional and the relational impact that a diagnosis has on the entire family. Our intervention approach, grounded in collaboration, education, and the real needs assessment, and the role of an environment which shapes every aspect of caregivers' ability to cope and adjust. By addressing everything from family emotion to the surrounding environment, our framework ensures that every intervention is grounded and interconnected with the reality of those we serve. One of the most powerful tools within this framework is education. Let me show you how we deliver it. Education is one of our most powerful tools, and we use in multiple ways. We deliver education in 3 modalities: virtual and in-person caregiver sections, professional training for healthcare providers, and community awareness campaigns across the island. Our focus areas include understand dementia progression and behavioral management, caregivers, self-care and resilience, and how to navigate the service system because it's very complicated. These sections have reached caregivers in municipalities across Puerto Rico, communities that in many cases had very limited access to kind of support before. For us is very important to know. But education alone is not enough. Let me share how we pair it with direct service coordination. Beyond education, we offer a structured care coordination model with the 3 service pathway: phone and email orientation. This is often the first point of contact. It provides initial outreach and service guidance to caregivers who reach out to us. We have a 2 case manager in the centers and 1 social worker to manage this orientation and email orientation. Individualized consultation, a personalized assessment and follow-up care plan for each caregiver because 2 situations of caregivers are not the same. And referral coordination, structured referrals and navigation support through the health and social service system. The impact of the model has been real. Reduce geographical barriers, improve service access, and ongoing support for caregivers who were previously navigating this journey alone. Now, we have another question for you, and this one touches on something very close to our work. Are there cultural, linguistic, or structural adaptation you have found effective in supporting Spanish-speaking dementia caregivers in your work? We ask this because cultural responsiveness is central to everything we do, and we truly believe we can learn as much from you as you can learn from us. So we have time to answer this question in the chat or use other modality to answer. Rosanna and Adia help me to identify these comments or the answer in the chat.
Well, let me read out. Shelley says that it's not applicable to her situation. On the contrary, Cynthia is telling us that in-person training is better than webinars. And then we have another comment telling us that translating materials in Spanish, promoting services where there are Spanish speakers. Of course, it's super important. Thank you so much for your feedback. Leveraging Spanish media in raising awareness during during morning or noon newscast. Yes, we are culturally or structural adapted to supportive Spanish speaking caregivers. And Judy says that they have over 20 Spanish speaking, countries in North, Central, and South America. Wow. And with that variations in language and customs around care in a very diverse city like Chicago. Elma here is encouraging us to feel free to share the links to sites or files. And Marisa is telling us that their community partners utilize translators. That's awesome. Explaining who is a caregiver, many family members do not realize that they are in fact a caregiver. And texting is very helpful among Latinos who experience access issues, but use texting a lot. Of course, we have to get on board with technology and use it in our favor. I totally agree. And we are an area in aging, we use the language line.
And there is also, if I can mention, Rosanna,
Of course.
from Marisa Romano's, in addition to interpreters or translators, CHWs, community health workers, are also known as promotores de salud, or maybe some other names. Some other titles are also leveraged as a public health strategy as well. I think that's a really, it's a very important one, as it really has the potential to reach and really make an impact in communities that might be harder to reach, or at times, or have more difficult, more limited access to resources often.
Yes. Adrián also shared with us that being aware of and incorporating strong cultural values, familismo, personalismo, respeto, dignidad, marianismo, machismo. And they are sharing their flyers, their links. Thank you so much for collaborating and sharing with us. I guess you can continue, Elba.
Okay. Thank you so much, everyone. Thank you, Rosanna, for your help. One of the most significant milestones in this work has been the development of a formal coalition and a strategic plan. Let me walk you through that journey. The ADRD strategic plan serves as Puerto Rico official roadmap for addressing Alzheimer's and related dementia as a primarily public health priority from 2026 to 2030. Its mission is to improve the quality of individuals affected and their caregivers in Puerto Rico. Its vision is to strengthen ADRD infrastructure, focus on early detection, risk reduction, prevention of avoidable hospitalization, caregiving support, research, and education. We began with the coalition launch, bringing together over 14 government agencies, academic institutions, and community organizations. Together, we conduct a comprehensive and participatory development process that leads to the creation of the ADRD Puerto Rico Strategic Plan. And we are now in the process of developing the implementation plan, translating these strategies into action. This is our photos of the process, and this is our plan. It's an official roadmap for addressing Alzheimer-related dementia has a primarily public health priority for 2026 to 2030. The plan is organized around 4 key action areas. Let's look at each one. First, risk reduction, empower the general population to adopt brain-healthy lifestyles. We address early detection and diagnosis, reducing delays by strengthening clinical capacity and community awareness. To attend caregiver support, improving the quality of life of ADRD caregivers by addressing their psychosocial needs, and prevention of avoidable hospitalization, reducing unnecessary hospital stays through better emergency protocols and caregiver education. Within the caregiver support area, we have a 4 specific strategic objective I want to highlight. These pillars, caregiver support action area, we have identified 4 key strategic objectives from ADRD Strategy Plan 2026 to 2030. Caregiver profile dissemination, so that policymakers and providers truly understand who caregivers are. Second, caregiver service mapping, to know what exists, where it is, and for whom. Needs and challenge assessment, to identify what caregivers actually needs. And service gaps identification, so we can advocate for what is still missing. This is a 4 strategic objective of this action area. And none of this work will be possible without the partners who walk alongside us. It's very important for us recognize, and we want to acknowledge our partners and collaborators for their sustaining and commitment over the past 2 years and thus to come. They have been our allies since day one. None of this will be possible without these partners. Our coalition includes partners from across sectors: Puerto Rico government agency, academic and research institutions, private organization, non-profit organization, and community representative, including social workers, nurses, caregivers, pharmacists, engineers, and physical therapists. This cross-sector collaboration is what makes our work sustainable and meaningful. A key part of what sustains this work is data. So let me show you how we use it. Data is at the heart of everything we do. The Alzheimer's case registry in the centers allows us to monitor case trends across municipalities, understand demographic shift, and identify where caregiver needs are highest. We also use data for sustainability planning to make the case for continued funding and long-term program continuity. And it serves as a powerful tool for policy and advocacy, giving us evidence to inform legislation and resources allocation and service design. Data guides our strategy, and the community engagement is how we bring the strategy to the life. Our engagement strategy operates at multiple levels. At the municipal level, we work directly with local governments and health regions, building partnership with the community leaders, faith-based organizations, and civil society groups. We reach caregivers through health fairs, community events, and local gatherings. All our materials are culturally and linguistic, tailored for Puerto Rican families. And we collaborate with promoters and community health workers because trusted messenger matter. But beyond the strategies and the structure, what truly matters is communication and collaboration, always keeping at the center the community we serve. Any person affected by dementia, whether they are a patients, a caregivers, a family members, or a provider. Together, we can build something meaningful in we put well-being and quality life of the people we are here for at the center of every decision. Today, someone will receive an official diagnosis. Today, a family members or caregivers will provide care with whatever opportunities and limitations they have. And today, thousands of providers will see a person living with dementia. Let us remember that our effort, no matter how small they may seem, go directly to these people. So it's very important. We can do. That is the heart of why we keep going, and this also what we carry into our lesson learned. After 2 years of building and operating this infrastructure, here is what we have learned. Caregiver support must be continuous and system-based, not occasional. One-time intervention are simply not enough. Education alone is insufficient. It must be paired with real service coordination. Coalition building is essential for long-term sustainability. Remote access models are critical because they reduce geographical and socioeconomic inequities. And data is a power. It strengthens advocacy, accountability, and planning. This lesson guides us as we look ahead to where we want to go next. We truly value this dialogue and insight you have shared to us today. Let me show, I go first. Okay. Looking ahead, we are focused on the priorities, funding sustainability, ensure that dementia care infrastructure can survive beyond current federal funding cycles is very important in this time. Data integration, improving the interoperability of our data system to enable real-time tracking and planning. Rural outreach, strengthening infrastructure and service in unserved municipalities, and respite and mental health, developing and expanding this service for caregivers because they need supports too. And with that, we open the floor for question or final reflection in the audience. Or Elma and Ashley have question, comments?
Excelente presentación. This was wonderful. Thank you, Elba, and the whole Puerto Rico team for being here with us. A great overview. I hope everybody was just as impressed as I was to learn about all of Puerto Rico's work over the last couple of years. It was such an intentional approach to really a very broad engagement. And I know that along the way, you also developed tools to support them and later to support the selection of partners and kind of align them with goals of the agency and how to collaborate together. So that was really, really impressive. So great work. That slide with all of your partners that really tells the story. I have one question that comes to mind for me. I can just begin with one, and I see a couple of hands raised already. You talked about community engagement strategies, Elba, and I would be interested in knowing how do you sustain, what mechanisms or what ways do you have in place, if any, to sustain engagement, to really elicit participation, meaningful participation and integration of people with lived experience of caregiving and of dementia, of cognitive impairment in your work? How what tools and mechanisms do you have to really integrate that?
It's very important to us maintain continuously this community engaged in our works. Not only receive information, but construct information or construct the strategy with us in the same table. The community is in the same table with us to construct or make or design strategies for this process, because when the people is part of them, we have pertenencia. ¿Me ayudas ahí?
Like belonging, a
Belonging.
sense of belonging
Belonging.
to the
Belonging
community.
con the community. Yes. The coalition have mensual meeting all month, the second Friday of month, to maintain this engagement with the members and the community they serve. Mhm.
Thank you, Elba. Maybe we could take a question from Mr. Michael Ellenbogen.
This was a great presentation, and thank you so much. I have a comment and a question. The comment I have is, and I just learned this the other day from a world-renowned doctor who's a neurologist, and he had said to me, he goes, the problem we have with dealing with people with dementia, and I am, by the way, living with dementia, he said, is we speak the wrong language. And I never thought about it. And it's not that we can't understand English, or whatever language we speak, that it's we did not understand how to communicate with people who have the disease, which I thought was really a fantastic way of explaining it. And I think it really requires a lot of more training that we all think we need. But the question I have is, do you have any idea why you have such higher cases of dementia? Has that been looked into at all? I don't know if you have covered that.
You can repeat the question, please?
Sure. You said at the very beginning that you had a much higher prevalence of people living with dementia in Puerto Rico versus the rest of the U.S. Do you know why that?
Okay. We are in this moment identify what cause. We have make investigation what because of what are the numbers are higher than the United States. In Puerto Rico, we have increasing all population. So in major increase all population, we have more diagnosis of, we have more numbers of diagnosis. So we not have one or raise a reason or a cause for increased number, but we are in the investigation process to identify. Puerto Rico is experiencing accelerated aging due to decline birth and rate and high immigration to United States or other countries. So Puerto Rico is these factors cause have more higher numbers.
Thank you, Elba. Yeah. And there might be also, I don't know if the detection through the registry, perhaps, I don't know. I don't know how the registry itself works, but maybe the access to detection within the context of primary care might be really particularly good, in the reporting as well. Might be contributing factors, perhaps. I don't know.
Yes. We are in the moment to educate providers who can report this case in the platform of the registered case. So we are educate to these providers registry in a good time framework that case. So
Mhm.
We can receive the information and we know understand where is the major case in Puerto Rico and what is the factor affect this population especially.
Mhm. Absolutely. Thank you. That reporting piece to the by providers. And I think Adrian Rodriguez had raised his hand, but he had to leave and he left us his question in the chat. Can you please share a bit more on how you structure your caregiver assessment? Are there specific surveys you integrate? For instance, the PHQ-9 or the Zarit-4 scale, different scales to measure caregiver burden, or the identity discrepancy?
Okay. We development and implement caregiver need assessment, and in the launch of coalition, we have two modalities: focus groups with the caregivers, informal caregivers, and an interview, a structured interview with providers to have or collect this information. And valuable information that the challenge and barrier and needs is the main focus of our needs assessment. What or which the barriers the caregivers have in Puerto Rico? Formal caregivers and informal caregivers or family caregivers that have this new role in the reality. So this is the main focus on our need assessment process.
Thank you. Thanks, Elva. There is a question. We have one question in the Q&A from Ms. Cynthia Lopez Paz. Are there caregiving programs available for individuals to apply with activities of daily living, specifically for Alzheimer's dementia patients? So maybe programs available in the community to support caregivers, which might be offered in Puerto Rico or accessible.
These questions are in the chat or are Q&A?
It's in the Q&A.
Okay, thank you. We have in the coalition many organizations that work with the caregiver all the time. Alzheimer's Association of Puerto Rico, De Frente al Alzheimer, this organization that give to the caregivers funds or money to the process to care other people. They also provide economic support. They offer direct community service that offers support groups and educational intervention at the community to enhance and educate the people with the needs or in the caregivers or in the care environment. Every organization targets different needs. So the Frente al Alzheimer is support economic supporting, and Alzheimer organization with the education, with the support groups and other issues they can serve with the people.
Yeah, absolutely. Thank you. Thank you. There's any questions? Anybody? Feel free to raise your hand. Any thoughts or questions you may want to share? You're welcome to. We still have a few minutes left. And this next comment by Ms. Alma Costa made me think of a question. In a lot of our Hispanic cultures, memory loss, Alzheimer's, and other dementia is thought of as part of the aging process. Many times I found that families do not report these changes because they think it's part of normal aging. So it really speaks to the need for public health to increase awareness and education about the process of aging and of dementia and improve public understanding of what cognitive impairment and dementia really is and how to recognize it, right? And that requires adapting our approaches, the communication, right, to the community and finding ways to best do that. And I was wondering if you would be able to share with us some of those examples, how they have been effective in terms of adapting, whether it's communication or adapting programs culturally to better serve the community that either you, your team, or your partners have done to adapt existing programs or develop new programs entirely.
Mhm. It's very important to us collaborate with partners. They have full programs or campaigns that, for example, the lifestyle or factors to risk factor in the Department of Health. We have many programs that diabetes or tobacco or with other problems. But for us, it's very important to insert the Alzheimer's or dementia subject in these campaigns. That is very important to us because these campaigns are ready. These campaigns are functional and have our campaigns are successful. So for us, it's very important insert this area of dementia, Alzheimer's and other dementia in these campaigns that have a very important is very important to Puerto Rico. So this one of a sample of you we can use the or collaborate with the other programs. Collect this is very important for us.
I can't find my, I want to raise my hand and I don't know where to do that. But can I ask a question?
Please go ahead, Ms. Alma.
Gracias. I'm from Vieques, Puerto Rico. So, saludos. Dios me lo bendiga
Saludos.
mucho. I would like to know, because Vieques and Culebra are separate municipalities of Puerto Rico, and getting there, it's either by boat or by plane. How do you guys manage to reach out to the people from Vieques and Culebra?
In this moment of the bowl funding in the coalition, we have in the process to contract a coordinadoras
A
regionales.
regional coordinator.
Regional
Regional
coordinator.
coordinator to attend the 4 regions in Puerto Rico, include Metro Fajardo region to use the education plan of the coalition to impact or go ahead to Vieques and Culebra, and the E4 we have made in the El Área metro area, we translate or carry on in this Vieques and Culebra. So for the work of both in the coalition, we need this collaboration with other organization and other people with líderes comunitaria or lideresas comunitaria. We need us because they can educate it and extend our effort in this area.
Thank you.
This reminds me of the most recent roundtable where we hosted. I believe it was Hawaii, a couple of months ago, and because of their geographic dispersion of all the municipalities and communities, a similar question was posed, and it is definitely a great challenge. It really sounds like building local capacity, providing materials and education, as you were doing as well, to respond to the local needs whenever possible.
Mhm. And in this moment, the center have a virtual section. We have people both Vieques in Culebra and outside of Puerto Rico participate with this virtual section. It is one of our goals to expand our outreach. So we are in this work, in this process here today.
Yeah, wonderful.
Yes.
There's been a lot of comments and actually quite a few resources shared, links and some attachments. Thank you, Rosanna, for including your strategic plan as well. We will share all of the content and all the materials and resources in our follow-up email along with the recording. And any other last minute questions? We have just about a minute left before we part, but we are so grateful to all of you, Elva and Nadia and Rosanna, for joining us today. And I see a number of members from your community here as well. What a great space. It's been great learning. Thank you so much for sharing your experience in Puerto Rico. Any last questions, comments from anybody?
Thank you so much, Elma, for this opportunity. We truly value this dialogue, and insight is very, very, very important for us. This kind of exchange is exactly what strengthens our work. Thank you so much for your time and attention. You would like to learn more about our work or connect with our team, please reach out using the contact information. Elma have it, and Avia maybe share the contact information in the chat.
Perfect.
Because it's very important for us. Together, we transform the landscape of care and strengthen the support system for caregivers and the families across Puerto Rico and beyond. So thank you so much for this opportunity. It's a privilege for me and for my team.
Thank you. Thank you all for being here. It's been a pleasure to have you. Muchas gracias.
Muchas gracias.
Have a good day.